Good morning, everybody. It's Jake Rahman here again, and welcome to the Sunday edition, or the first one of Between Two Simulators. And today we're delighted to have Kevin King with us, who's the head of business development at 3B Scientific. I've known Kevin for quite some time, and our careers have run in a parallel direction, and in some ways, and it's really interesting to have a representative from 3B Scientific here. So thanks for coming along, Kevin.
It's a pleasure to be here, and thank you for inviting me. I'm honored.
No problem. So I'm going to go through a few questions for you. I want to find out a little bit more about you, Kevin, but also as well, 3B Scientific, there's a lot going on there, so we will touch on that as well. Kevin, I wonder if you could give us a quick outline of your clinical career and how it brought you into healthcare simulation, really.
Sure. Yeah. I came somewhat non-traditionally into simulation. I was a paramedic for many years, and transitioned from a land paramedic in Canada. So if you hear my outs and abouts and A's, I come by them honestly in terms of speech. And then I transitioned into my role in a flight capacity, and I worked on a helicopter in Toronto, and it was the busiest helicopter in the country. And one of the sentinel events that happened in all of our lifetimes, unfortunately, as we know, was the events of 9/11. And the events of 9/11 saw me go into what we called as a ready state, a hot ready state, at our Toronto Island base, and that meant that we were basically meant to respond to the events of 9/11. Now, we never did, but they put us in a ready state, meaning that I contacted my dispatch center, and I got all the details very early on from our dispatch center saying, look, there's been, as we thought at the time, a terrible accident, and we're going to launch critical care resources towards this accident, and we're basically get prepared for that. So my questions back as clinicians, and I know you're a clinician as well, was start to mentally triage, and I said, well, how many patients are there? And they said 3,000 to 4,000, we think. And I said, well, how many resources are responding at the critical care level, the level that I had been trained to? And they said 3. So that meant there were 6 providers that would have responded. So I didn't have a very good mental reaction to that. I thought, well, gosh, the first thing in my mind was, I wish there was a way to train paramedics better how to deal with that emotional state than there was. So if you can take 3 days in class to teach me how to roll someone onto a spine board, you can certainly take some time to talk through the preparation mentally to deal with something like that. So right around that time, I was exposed to some of the very first and early technology that METI had to offer at the time, as you know, and you've been around almost as long as I have been. And I thought, wow, this is really cool technology. And if you can replicate the human condition, if you can replicate conditions that allow for me to treat and make decisions in a high stress, low frequency type of situation, then I'm for it. So I became one of the very first clinical educators at Lou Oberndorf. I believe he was one of your guests yesterday. He hired me as a part-time educator and facilitator at METI back in 2002. So that's when my simulation career started. So there's a lot of math in between there that takes us to where we're at right now, and started evolving my career. So I worked part-time with Lou while I was still a practicing flight paramedic. I was a clinical educator at the same time, and I tried to utilize as much as I could in terms of medical simulation, even without really knowing it. So I became a fellow at the MIT Harvard program, the Center for Medical Simulation. I went down, and that really started to kind of put in my head how to use simulation from an educational perspective and drive what it was that I wanted to accomplish. And I didn't really know. So I went back to school in 2010 to complete my MBA because I had no business experience whatsoever. So I went back to school when I was 40, much to my wife's chagrin. And I became not a full-time student, but it certainly felt like a full-time student. She had to teach me mathematics. She had to teach me a lot of stuff to get me through that. And after that, I decided to come and work with METI full-time. So I signed my paperwork with METI, and 2 days after I had signed my paperwork with METI, they had said, right, get on a plane and come to Florida. I was still in Toronto, remember? And we have an announcement to make, and I thought, well, gosh, what's that announcement? I'm going to be fired? They said, no, we do that over the phone. Right? So they said, no, come on down. And what it was that CAE had purchased METI. So that was that 2-day period of time. So I started working the sales and business development side and had kind of advanced my career to become the vice president of sales with CAE in North America. And then in 2018, decided that if I didn't go out on my own, and I've got some fundamental strong beliefs in terms of what simulation should be. You and I have talked about it, and we will talk about it some more. And I didn't see that happening in the industry. So that was my 50th birthday anniversary. So I decided to cash in all my retirement savings and found my own company. And that's what I did. And so we did that in 2018. And just this past January, we successfully sold that company to 3B Scientific, where I've now joined them as the head of business development. Through that journey, I've learned a lot. And I'm happy to share more of that story as excuse me, as you see fit.
Yeah. I mean, it's a great story, and sort of the transition in a company, especially from METI to CAE, and then of course it's going in a different direction now. But for you personally to work through the industry and gain the knowledge that you have is, I think it's a very valuable asset, to be honest. Now 3B Scientific, you're with these guys, which are, they are trying to take over the world, it seems. What's going on? From our point of view in healthcare simulation and representing various commercial companies, 3B Scientific have always seemed to be sort of under the radar. But now with their acquisition of Echo and a number of other companies, which if you could tell us all about, that would be great. It seems that suddenly they are a major player in healthcare simulation. So I wonder if you could tell me, what's going to happen, because I'm moving fast, because if we don't move fast in this room, 3B Scientific might even buy us all.
Yeah, that's right.
So tell us what's happening. Where's this growth coming from? Why now?
I think it's a great question. And I think, you better be careful, because I'll be looking for you shortly if you can actually keep your feet planted on the ground and take the wings off your high tops for a few minutes. But I think what's interesting about 3B's strategy is it's very deliberate. So deliberate doesn't necessarily mean loud. It doesn't necessarily mean, majorly exposing themselves without having a degree of thought behind it. And I'm certainly not criticizing anybody who is out there. I think anybody who is in this industry that's had the tenacity to stick around in this industry deserves our applause for that as well. So 3B, when they, their first acquisition was iSimulate, which is now going back, I believe, 5 years. And since that time, there's been 7 or 8 companies that have been acquired. And the idea is to become a solutions-oriented company, and I'm very passionate about that. I don't like, much like yourself, we've talked about it, I don't like products for the sake of products that aren't serving a purpose. If there are no square pegs, don't make square things to go in those pegs. And I think that what attracted me to 3B and my conversations with 3B's leadership was the fact that we were aligned in terms of focusing on what the end goal was. And for me, it's nothing more than to improve patient care, but of course the continuum to get there is a little more complicated. And I think to be able to do that, you need to say, right, we need to have a company that does, we've got strategic operations, for example, that services a lot of the military and government services from a surgical perspective. So there's a nice element of training that's contained there. The life cast mannequins, they really create emotion in students, and much like my story that I told you to begin with, the emotion of learning is where stress enters, and when stress enters, mistakes enter. And if we can start to minimize those by using training, I'm not going to be bold enough to say our products save lives. Products don't save lives. Utilizing them to train appropriately, hopefully at the end of the day, it means that your patients are doing better. Absolutely. Did that answer your question? Yeah, it does. And I think you touched on something there. I think we've got to be clear that in healthcare simulation, the products that are out there, for me,
do they help people save lives? They help the people who help people save lives.
Yeah, that's a good way to put it.
That's the way I like to put it, because if they're used correctly, then they will work properly, and we will save more lives. There will be less errors in healthcare overall. Freebie Scientific have been around since 1948. That's amazing.
Yeah, a long time.
And they've got a huge sort of scientific background behind them, research background. How do you think that's going to complement what they do in healthcare simulation?
Incredible. It's a really great question, and I probably wouldn't have been able to answer that a year ago, even when we started this journey with them. So, anatomy and kind of what I would call primary care. It's probably certainly in the medical community, it's the wrong terminology, but primary care is in charts, books, anatomy, models, static, fiberglass models, plastic models. I think created a good foundation to bring a group of scientists together to say, right, if we're going to use this to start to teach you remember first principles back when we started our clinical career, teaching from first principles means I need to see what a heart looks like. Before I talk about, where the perfusion issues can happen in a heart. I know ultrasound is a specialty of yours, so I can't just show you an ultrasound and you say, right, what am I looking at? It could be an apple, if you didn't get trained for it. So a lot of the fundamental tools that they created to begin with, I think paved the way to say, right, now that the evolution, simulation in the 40s was you and I, wasn't it? It was practicing on real patients. And even when I went to school as a paramedic, we started IV, I still have the scars. We started IVs on one another, and that's how we practice. So evolving to where we're at right now, it's moving at a really, really fast pace. And I think that 3D identified early on from our roots in anatomy, physiology as well. This seems like a natural progression to include simulation into the wheelhouse of what they're doing. Yeah,
I believe so as well. And it also gives it lots more credibility as well, that they've got that research background behind them. So we haven't really spoken much about Freebie Scientific with regard to R&D and new products. How is it all going to work out with regard to the new products and bringing them all together, etc.?
I think for me, that's a great question. I think for me, it was one of those, be careful what you wish for, because that'll fall a little bit into my wheelhouse. I'm very impatient when it comes to looking at kits and products and saying, I know that we've got Ingmar in our portfolio, for example, and I've got LifeCast. So it doesn't take a genius in our minds to say, could you put, this product inside of this product? Even at Echo, when I was running Echo, with the group of engineers we had, whether they were looking at developing the Melissa app or anything else, invariably they didn't like the call from me saying, right, when's it going to be ready? And they would say, there's a lot, Kevin, that has to go on behind that. And I say, the question was, when's it going to be ready, isn't it? It wasn't, what's the work behind it? So I'm starting to appreciate more the work behind it. It hasn't tempered my patience any, because I'm still impatient saying, right, I would love to see all these things come together. But looking in the crystal ball, you can certainly imagine that that's what's going to happen, is that there's going to be hybridization of what some of the products are. And I use that term cautiously, because companies that we've come from in the past have used that term as well. And invariably, on the commercial side, I was disappointed that they never made it to fruition. And again, if you're serving to confuse the teaching public, then the students are going to be confused. Patients invariably are going to do worse right at the end of that continuum.
Yeah, exactly. And if you do have hybrid products and bring them together, it's got to be right. It's got to be that fit. You can't force it.
It must be deliberate.
Yeah, right? Exactly. So just a couple more questions, really. Obviously, you mentioned Lou beforehand, but who are your heroes really in healthcare simulation?
So touching on it, and I don't let an opportunity go by as I'm talking about medical simulation and my career to give credit where it's due, and the majority of credit lies with Lou Obendorf. He's here, again, for another IMSH with both the companies representing and his charity that supports his foundation that supports the speaking folks who are here as well. He believed in me when really nobody else did in the industry. He was one of those guys saying, and here's a saying he gave to me, and if he sees this podcast, he'll laugh when he hears it. He took me aside probably 2 years into it when I said, I want to do all things in medical simulation. I thought I was a great paramedic. Why? Because maybe 2 people told me I was a great paramedic. But he said, Kevin, you're all airspeed and you're no direction. So you have airspeed. And so if you want direction, then you need to focus on, do you want to be on the business development side? Do you want to be on the education side? Not that you have to choose necessarily one or the other, but to come out with guns a-blazing, you're just going to run out of fuel. And you probably are not going to, you'll be frustrated yourself. You're not going to accomplish your goal. So de facto, he's the most influential person in my orbit, that's for sure. My time at CMS in Boston, the joint between Harvard and MIT, Dr. Dan Raymer, Jenny Rudolph, they're both here. We're foundational in terms of how to start teaching with medical simulation. So I owe them a debt of gratitude as well for teaching me how to do that. But first with paramedics, and then as I got to teach nursing, and then allied health on down the line as well.
Yeah, fantastic. I mean, certainly, like I said, Lou, it was great. It was a very charismatic guy. It was great talking to him yesterday, for sure. And really, I'm asking this to most people, and my opinions aside. What about industry regulation? And let's frame that, put some context on it. So healthcare simulation overall works in an area where, in parallel to pharmaceuticals, in parallel to medical devices, and even the qualification in themselves, it's all registered and regulated, etc., etc. What about healthcare simulation, both in the delivering and in industry? Do you think it should be regulated?
Well, it's the $1 million question, isn't it? It's the question that we've been asking for. I think it's that elusive brass ring that not just companies, but as we come to these plenary sessions, as we listen to folks saying we've been using simulation, starting out 25 years ago, when around the time when I did, in pockets, and some people were doing it really, really well. Why? Because they said so. There wasn't anything that they were measuring it against. This notion of accreditation only came around more recently in that continuum. But I think for me, the spoiler alert is I'll go to the end first and back up from there. If it isn't about the patient and it's about your ego and the way you're doing things, you're doing it wrong as far as I'm concerned. So whatever supports the goal to improve the patient care needs to be, and ideally if we use the aviation world as the metric to measure ourselves against, then it should be. Is it easy? It's not easy. And I think that there's a lot of wrong paths that can be taken, have been taken to get there. I think that we owe it to patients to say, can we standardize? I guess CPR would be an easy one, wouldn't it? Because we talked a little bit about some of the products that are out there that can measure, a depth of compressions, rate of compressions. They self-guide you, don't they? I haven't actually tried. I'm scared to try it. It's been a while since I've touched a patient, but they'll guide you. So I can't see that not being effective, further down the line with, training learners to do that. The more they train to do it, the better they are. Are we there yet? I don't think we're there yet. I don't think we're there yet. I think that there's still a lot of selfish thinking in the industry that prevents us from moving ahead. I don't know if you're aware, and you're going to correct me because I know you're more scholarly in these things. It was Volvo, I think, was one of the car manufacturers that came up. Was it an airbag or a seatbelt?
It was a seatbelt.
It was a seatbelt, right? And then they made that technology available to all car manufacturers. And then that de facto raised the safety standard of traveling by automobile worldwide, didn't it? Across every manufacturer. From the elites of the Ferraris all the way down to the pedestrian of Vauxhalls, Chevys and so on here. Are we there? We're not there. Is there cool technology? There's really cool technology that I've seen. And I think there's technology that will advance medical simulation to the point where we can create something that's replicable, which you have to create something that's replicable to standardize it, to measure a student against. And that's what it would, I think that's what it's going to take to become standardized. The 737 aircraft are identical, aren't they? I mean, they're identical. So it becomes easier. No disrespect to the pilots in the crowd, but it becomes easier to get rated on that aircraft because it doesn't matter if you're going to fly one from Heathrow, if you're going to fly one from Atlanta. You're expecting to see the same thing. We know no two patients are the same. However, if we can get closer to, something solid that we can measure, then I would like to see it regulated and standardized. But I think it's going to take some work, isn't it?
I think so too.
To get there,
It takes some work. work, and I think you touched on there are specific things that could potentially be regulated and then standardized first, so it could be a gradual sort of step into regulation really. But yeah, I mean it's a broad question. Some people say that regulation will stop innovation. I don't think it will.
What do you think? You tell me what you think about it.
I tell you what I think. I think that a great example, like you said, was with the seatbelt. If we could have on a mannequin a pulse, for instance, that feels exactly like a real pulse, it's amazing, and everybody could come to an agreement that that pulse felt as realistic as possible. Why wouldn't that be replicated across other simulators so you've reached a minimum standard?
Right.
And that's my fault on it. But there are other opinions in there. But anyway, Kevin, it's been fantastic having you here. Okay,
thank you so much
talk all day with you.
Yeah.
And yeah, good luck in your career with 3D Scientific.
Thanks, mate. It's great to see you again.
Good to see you. Good to see you. And I'll pop over and see you guys later on.
Please do. Yeah, come on by.
Thanks very much. Cheers.
All right. Bye now.
Bye bye.